So Toriyoshimasu stated that there are no difficult disease presentations, that in fact, it's only when somebody comes along that has better understanding that makes it look simple. And it's so true. Like even just in my experience to seeing patients, and I do see that in fact, you see a lot of complex disease presentations and they're really not that difficult. It's just when you understand the herbs and you know your tools and you know how to identify why the body's presenting in a certain way, some difficult, complex, messy patterns actually do look simple. And it occurred to me, there's this case that just came in a few weeks ago. He came from hours away, he came to the clinic, and he had diverticulitis, so he had severe abdominal pain. And he had seen all these different practitioners and herbalists and doctors. He'd seen everybody, and I think it's a good example because you see stuff like this all the time where something that looks so complex, but it is actually so simple. And I just want to show you how simple something can be if you have the right information. And I just want to run through how easy it is to identify these herbs and formula patterns. Not just with a clear understanding of herbs and forms, but also if you don't have a clear understanding of every herb and every dosage of a herb and all the herbal relationships within that formula structure, if you don't have that understanding, that is what the team app is for. It has two methods to identify it. It has the herb identification method where you can add herbs in to work out formula structures, or you can actually use signs and symptoms. You can use signs and symptoms, you can use tongue coding, you can use pulse if you're good at pulse, and an abdominal as well. So there's two ways to use the app: the formula identification method and the herb identification method. And when I went into the room, when I consulted with him, he was in so much pain, he was actually lying on the bed already. So I figured I might as well just check his abdominal and just scan his abdominal whilst he's on the table. Normally I would get people to sit upright in a position so I can take their pulse and ask the appropriate questions and then confirm it on the abdominal and the tongue coding. But he was in so much pain, he was actually already on the table because it was an excruciating abdominal pain. And I checked his abdominal and the rectus abdominals were so wired, they were so tight and contracted. So he had responsive discomfort bilateral to the umbilicus, which indicated a herb called peony root biashao. So already when I just quickly scanned his abdominal, I knew in fact that there was biashao there. And then I confirmed that with a secondary question of biashao. The second indication of peony root biashao is always restless legs or cramping, which he confirmed as well. And when I knew that biashao was in there, one of the questions I generally always tend to ask is if they get thirsty or foggy or dizzy, because there's a few formula structures with abdominal pain with biashao in it where you get extremely thirsty or you get foggy or dizzy, especially the Zhejiang formula structures and Dangwei Xiaoyao-san. And he reported that he neither had thirst, it was just a normal thirst, and that in fact he never had any dizziness or fogginess. So already that I'm ruling out certain formula structures. And the next question I always ask as well with these abdominal pains, because it's so common nowadays, because people eat the wrong foods, eat too quickly, they eat too late. Eating too late is so common because when the sun sets, whatever you eat always sits in the upper epigastrium. It causes responsive fullness and discomfort in through the bowel. And when I scanned his abdominal, he didn't have any fullness, he had no shapes, he had no discomfort, but I still always ask the questions to confirm it. And he had a normal appetite, he had no constipation, he had no dry hard stool, he had no sticky soft stool. He in fact had watery loose stools. So then I can rule out the fact that there's no Da Huang rhubarb root in this formula structure. So I'm already ruling out all these herbs and formula structures in my mind. I can have a clear understanding of what to ask next. The second things I looked at on his abdominal was there was no responsive sphere in the upper epigastrium. So between the umbilicus and the xiphoid process, there was no ginseng, there was no renshen. There were pulsations, but they were only from the umbilicus to CV10. They were only just a little high, but there was splashing up under the diaphragm, up under the xiphoid process below the heart. So then I asked him about shortness of breath and things like that, and he confirmed that. And then when I scanned through his lower abdominal, there's no rough, dry skin, so I'm ruling out herbs and formula structures. And I'm coming down in through below the umbilicus on his right side, there was no responsive discomfort. So when I pressed him through the right side below his umbilicus, it was not uncomfortable. There was no responsive discomfort or pain going to his groin or lower back, moving down. So I'm eliminating angelica root. So already that I know that there's biashao in these formula structures, and then when I scan up under his diaphragm, it was very responsive and uncomfortable up under the ribs, which indicated the herb chaihu. And then with Chahu as well, that's why I always ask about the shortness of breath, because when the diaphragm locks up, it causes contraction, and it doesn't allow the lungs to open and expand, so you always get shortness of breath. So now I can confirm he has shortness of breath, he gets very bad severe abdominal pains, but I'm already considering certain herbs and formula structures. And when I quickly looked at his pulse while he was lying there, I confirmed that the middle guam position was a bit floating wire. It was on the middle guam position, floating wire and tight, which indicates that diaphragm was in fact locked up, and that indicates the herb Chahu. It's an important question because I was also considering the herb pine lung sam, which is very common for diverticulitis with pus. But when there's Chahu in the formula structure, I can rule that out straight away. So I already know there's no intestinal obstructions, there's no angelica root, there's no pulsations to the xiphoid process, there's no Ren Shen. And then when I checked his fingers and toes, they're freezing cold. And then I asked, did you get headaches or migraines? Because when you get these cine patterns, it means the blood vessels are vasoconstricted and inhibits the move of warm blood to the extremities. The fingers and toes get cold, but the neck, nape, and head always contract as well. This is considered a part of the extremities. And he did get tight neck and shoulders, and he did get headaches. And then when I got him to stick his tongue out, it was very yellow. It was like a bright yellow tongue coating from the middle to back. So it wasn't thick, so there's no dahong, but it was this bright yellow tongue coating, which indicates that herb Jershi. And that always has pulsations from the umbilicus to CV10, and it does have splashing. So I'm confirming the questions against the tongue, against the abdominal. I'm scanning everything, and I've already come to the conclusion, just with these basic questions, that it is in fact the formula Sini-san. And when I saw that, it just reminded me of what Toto said about, even though something seems so difficult and complex, it's just when someone with just a better understanding of herbs and patterns and structures comes along and they can work out these patterns and structures just with much more ease. Again, I'm not saying that I'm perfect, I'm just saying it's just a clear understanding of function and structure and how disease patterns always relate to formula patterns and how you combine the two to create the complete outcome, that complete treatment outcome. And then he reported to me, because he travelled for so far away, he reported to me basically every few days because I couldn't see him for another 2 weeks. And after 2 to 3 days, his bowels were normal. So all the water-loose stool had alleviated. So that means basically the blood vessels are vasodilating, so everything's starting to warm. So when you alleviate the contraction under the ribs, it opens the diaphragm, and then the peony root will actually alleviate the contraction and tightness of the rectus abdominis. So it's opening and relaxing, which is restoring the movement of warm blood from the heart to the small intestine. So now when the small intestine warms, it can warm fluids and blood. So the first sign of fluids warming is when they warm, they get sent into the large intestine in a more functional form, more normal form. So they're not loose or they're not putrid. It just harmonizes that function. And I asked him about the abdominal pain. He's saying the abdominal pain is only happening periodically now. So it's not there all the time anymore. It's just coming and going. And then after a few days after that, he reported to me that he's had no abdominal pain anymore. So the bowels are perfect. They're once a day, appetite, everything's all good. And his only concern was that are the herbs going to run out? And if he runs out of herbs, is the pattern or presentation going to come back? And the thing with herbal medicine, what people don't, I don't think many people know that herbs are not like supplements. They're not like you need to take them continuously. You remember that all herbs are toxins. They have a very specific action and reaction on the body. As soon as you clear a structure or function, the abdominal returns to normal, you'll always stop the herbs. But I did tell him that I would send him some more herbs, and then I made sure he came back. So I wanted to confirm everything in the next 2 weeks. So when I saw him again last week, the rectus abdominals had completely alleviated. So there was no contraction and tightness. Everything under the diaphragm was nice and soft. His pulses, the wiriness and the tightness in the pulses that alleviated, which means the blood's starting to warm and the blood vessels are vasodilating, so that tightness and contractions of the pulses are gone. The tongue coating was basically nice now, so there was no bright yellow, thick yellow tongue coating anymore, which means he's metabolizing foods and fluids properly. And when he came in, he just came in with a happy face. He was like, had no abdominal pain. It was like a completely different person to what I saw him. But again, it was not it was not a complex pattern. It was just a clear Sini-san pattern, 4 herbs. And within that 4 herb formula structure as well, especially with diverticulitis and abdominal pain, there's a formula called Zershi Baisao-san, which is used for consumptive, which means taxation, exhaustion, abdominal pain with pus. So I already knew that within Sini-san, there's two herbs in that formula structure that will also help with not just the abdominal pain, but also the pus. Pus is just when the fluids cool down, they can become turbid and thick, and when they become turbid and thick, they turn into pus. And when you alleviate that contraction and fluids start moving properly, everything starts to harmonize. But this was not a difficult case. This was a very simple case, but it's a good example of just having a clear understanding of herbs and formula structures and how they align to a very specific disease pattern. So when you align the herbs to the disease pattern, so the formula pattern to the disease pattern, they rule each other out and they restore natural function. And I knew the treatment was complete because his abdominal structure had basically completely relaxed. So there was no tightness, no contraction. There was basically no indications of continuing the herbs anymore. So when I was looking at the herbs, if I'm using the herb identification method, when I checked his abdominal, I could definitely identify peony root bichia and then confirm it with the restless legs and the cramping. So if I know that bichia is in the formula structures, I can click bichia and I've got all these formula structures to choose from. And the second herb that I'm considering is because when I scanned his pulse, the middle guam position was a little bit floating wiry. So I know that there is most likely a chahu pattern there. So when I checked his rectus abdominal, checked up through the costals, there was a lot of responsive tightness under the diaphragm, which indicates the herb chahu. So already I know that there's two herbs in that formula structure, bichia and chahu. And now I've got 4 formulas to look at. And when I questioned him about his bowels and constipation and checked his abdominal and tongue coating, there was no responsive fullness, there was no shapes. He had a good appetite as well. And there was no stickiness or constipation or dry hard stool. So then I can eliminate dahuang. So then I'm just looking at certain formula structures. So I've got chahu guaitatang and I've got sinisan. And when you're looking at chahu guaitatang, there's ginseng, there's renshen in that formula structure. So when you scan the abdominal, you can see there's a non-responsive sphere in the upper epigastrium, always between the umbilicus and the xiphoid process, which he did not have. He had a clear empty space from all through the rectus abdominals. There was nothing in through the middle position and through the abdominal. So I can eliminate renshen. So that's what brings me back to sinisan. And then I will scan the abdominal and ask the questions and look at the tongue coating to confirm it. So if you're using the herb identification method, it's very simple to use. And then if I'm using the formula identification method, I know that he has severe abdominal pain. So if I go through the abdominal questions and add in severe abdominal pain, that's one thing I can confirm. And then when I look at his tongue coating, I know in fact that it is a yellow, bright yellow tongue coating from the middle to back. So I can add that into the tongue question. And just from questioning, I know that he has watery loose stools. So he has frequent bowel motions throughout the day. And then I know that he has no thirst. He has no thirst, he has no fogginess, he has no dizziness. So I can make sure, I can just add into the app that there is just a normal, moderate to no thirst. So now I've got normal to moderate to no thirst, watery loose stools, responsive rectus abdominals, which just means abdominal pain, and a turbid yellow tongue coating. So these are the 4 questions that I'm going to put into the app now. So I've got 1, 2, 3, 4, 5, 6, 7. I've got 7 formula structures to consider. If I was to look at these formula structures now, there's Futsa aconite in there. So Futsa and aconite, it can always have a lot of abdominal pain and discomfort caused by more coldness of the small intestine. So when the temperature of the small intestine cools down, it causes the blood and body fluids to contract. So fluids don't warm. So when the fluids don't warm, you can get watery loose stools and abdominal pain, because whenever there is any type of contraction or CNE where the blood and body fluids aren't warming, everything starts to vasoconstrict, everything contracts and tightens. But I can rule Futsa out because when I checked his abdominal, there's no coldness or tightness, there's no aversion to cold. So I know that there's no Futsa in that formula structure. Also in that formula Futsa tongue, there's renshen in there. And we know that renshen ginseng always has that non-responsive sphere. So we know in fact that can't be there. So we can rule that out. The second formula we can look at is Huangqi Guizi Wu Tang. So there's always, with this formula structure, there's always usually some type of sweating, because there's also Huangqi and Guizi in there, and there's a high dose of fresh ginger as well, but there was no rough, dry skin on his abdominal. And we know in fact that there was tight responsive underneath the costals, underneath the rib cage, and the middle guam position on the pulse was a little bit tight to wire. So we know there is in fact some type of contraction or tightness up under the ribs. The other formula they suggested is Zhenwu Tang, and again Zhenwu Tang has Futsa aconite in it. We know there is no Futsa aconite in it. The other formula that's suggested is a formula called Wenjing Tang, And with Wenjing tongue, there's a herb called Mai Men Dong, and that always has pulsations up to the xiphoid process, which he did not have, and it has ginseng Renshen in it, and he did not have any non-responsive sphere. There's Angelica root Dungwei in it, and that always presents with a little bit of contractus responsive below the umbilicus on the right, and when you press on it, it radiates into the lower pelvis, groin, or lower back. He had none of that as well, so we know that there is no Wenjing tongue. And then we come back to the formula Sinisan again. So you can use the formula identification method, you can use the herb identification method. Sometimes in the clinic, I will consider the herb identification method if I'm perhaps thinking or missing something. So it's always good to run through that and just to identify and make sure you're not missing anything. But I would be using this app if you cannot memorize formula structures and patterns, because this will help you identify the pattern, the structure, or help you to understand the story to basically connect that disease pattern to the correct formula pattern. And then you can have complete confidence in what you're prescribing. And that's why signs and symptoms, they're almost a gift. They're almost, when you have an understanding of what someone presents with, it's almost a gift because they're just giving the information to know what to prescribe. So I think this is a good example of what Toto said, that there's no difficult disease presentations, there's no difficult disease names. It's just when someone has a better understanding of something, it just makes it look simple.